Now, 36% of all tuberculosis deaths are reported in Africa. Nigeria accounts for more than 200,000 cases of tuberculosis each year, with many more declared as missing cases. As the world marks the World Tuberculosis Day, experts want these present statistics to change through investments, awareness and advocacy to end TB by the year 2030. Kemi Balogun has more details in this report.
Tuberculosis remains one of the world's deadliest infectious diseases. It is a serious bacterial disease that mainly affects the lungs. The bacteria is spread when an infected person coughs or sneezes. Jatau Amos is a tuberculosis survivor who started coughing but didn't realize that what he had was tuberculosis.
I was in and out of the hospital for, I think, 5 months or so. And finally, I wasn't coughing, like the cough was just almost normal. But I had lost weight, I had fever, I had the night sweats and all of that. Like that, I met the doctors and started treatment.
This year's focus is on ensuring that enough awareness is raised. Only about 25% of Nigerians are aware of the existence of tuberculosis. Since the year 2000, about 66 million lives have been saved through interventions from the dreaded yet preventable tuberculosis disease.
Tuberculosis and others have been said. The treatment, the diagnosis and the treatments, they're all free. And so nobody has the right to die of tuberculosis.
Funding still remains one of the biggest challenges towards achieving the target. Only about 22% of the resources required to deliver adequate TB services are contributed by governments in African countries.
There was 70% gap in funding for TB. And I would really like to tell you there's equally 70% gap in TB case finding. What does that show? The more resources we have, the more we will be able to find the missing cases.
Through our data performance in 2001, we are able to notify above 207,000 missing cases. These are new cases. And when you look at it and compare it with what we've been having in this country, that stands out as the highest ever.
The reporting of TB cases from the private sector has increased to close to 40% at the end of the last year, which is really commendable. But we know that there's still a lot of room for increase. Nigeria has reached the 200,000 mark of the number of TB cases reported in the country. And we know that this is just about half of the cases that are out there.
With the right awareness and intervention, TB survivors like Jatau can get the needed treatment in order to avoid thousands of annual deaths. Investment in tuberculosis response can be a game changer and help to save millions of lives. Kemi Balogun, TVC News, Abuja.